How to make a warm compress. Warm compresses can be used to treat a variety of issues, from muscle soreness to joint stiffness. While you can buy heat packs at the pharmacy, it's just as easy to make one yourself with simple, cheap materials you probably already have laying around your house. Warm compresses can help to reduce pain from menstrual cramps, abdominal muscle cramps, and muscle spasms. Before treating a condition with a warm compress, make sure you know whether your medical issue is best treated by the application of heat or cold, and make sure you take the proper safety precautions to protect yourself from potential burns. Making a fragrant warm compress. 1. Gather your materials. All you need for the basic compress is a clean tube sock and some dry, uncooked rice, beans or oats to go inside it. However, if you want to give the compress a pleasant fragrance, you'll also need a little bit of powdered peppermint, cinnamon, or whichever aroma you'd prefer. You can use some herbs from your kitchen, the contents of an herbal tea bag or essential oils. 2. Fill the tube sock. Whether you're using the rice, beans, or oats, pour them into the tube sock until it's mostly full, about 1/2 to 3/4 full. Just leave enough sock material on the end to tie a knot, unless you plan on sewing the end of the sock to make a permanent warm compress. Then you can fill it nearly to the top. 3. Seal the open end of the tube sock. Depending on how long you want to keep your compress, you can seal the sock temporarily or permanently. Tying a firm knot into the sock will keep the contents in place for a short period of time, but let you reuse the sock later. You can also sew the open end of the sock together for a more permanent compress. 4. Microwave the compress. After you have sealed your compress, microwave it for 30 seconds. After 30 seconds you can feel it and see how warm it is. If you are happy with the level of warmth, you can take it out and use it. If you want it to be warmer, continue microwaving the compress in increments of 10 seconds until the compress is as warm as you'd like it to be. 5. Place a barrier between your skin and the compress. You can wrap the compress or place a towel or t-shirt on your skin where you plan to use the heat. This will prevent skin damage or burning. Make sure you check your skin every few minutes to make sure your skin is still in good shape. 6. Place the compress against your skin. If it feels uncomfortably hot, remove it right away and wait for the compress to cool a bit before replacing it. When the compress has reached a comfortable temperature, hold the compress to the sore area for 10 minutes. After 10 minutes, remove it to let the skin cool down a bit. After allowing your skin to cool down, you can reapply it for another 10 minutes if you wish. Making a steamed warm compress. 1. Moisten a clean washcloth. Run water over the washcloth until it's saturated with water. It should be dripping wet. Then place the cloth in a resealable plastic bag. Fold the cloth neatly to ensure it will heat up evenly when you put it in the microwave. Do not seal the bag yet at this point. 2. Microwave the bagged washcloth. With the bag left open, place the bag and towel in the center of the microwave. Heat on high for 30 to 60 seconds, adding time in 10-second increments until it reaches the temperature you're looking for. 3. Use a kettle as an alternative. If you don't have a microwave or feel uncomfortable microwaving plastic, you can simply heat some water up in a kettle on the stovetop. Place the washcloth into a bowl and pour the boiling water over the washcloth. Then use tongs to insert it into the plastic bag. 4. Be careful when handling the plastic bag. Because the washcloth was saturated in water, there may be scalding hot steam coming from the plastic bag. Exercise caution when removing the bag and washcloth from the microwave to prevent burns. Hot steam can seriously burn the skin even if you don't get direct contact with the hot object. 5. Seal the washcloth into the bag. When you've microwaved the wet washcloth to your ideal temperature, you want to seal the steam and heat into the bag to prevent it from cooling too rapidly. Again, be careful not to burn yourself. Steam can cause severe burns and it is absolutely essential that you protect yourself. Cover your fingertips with another washcloth or a pair of oven mitts to your skin. 7. Place the wrapped compress against your skin. Allow the compress to cool if it feels uncomfortably warm. Remember to give your skin a break from the heat every 10 minutes, and don't apply the compress for longer than 20 minutes. Determining when to use a warm compress. 1. Apply heat to sore muscles. Sore muscles are often the result of excessive lactic acid buildup in the muscle tissue. When you use a warm compress on a sore muscle, the heat draws more blood to that area. The increased circulation flushes away excessive lactic acid, making your muscles feel less sore. It also brings more oxygen to the area, speeding up the healing process for damaged tissue. The warm sensation can distract the nervous system, decreasing the amount of pain signals sent to the brain. 2. Use moist heat to treat muscle spasms. If you experience prolonged muscle spasms, your first step is to rest the affected muscle. Take it easy, and avoid the activity that stressed your muscle to the point of spasm in the first place. Wait 72 hours to apply heat, letting any inflammation in the area diminish. After the 3 days have passed, apply a moist warm compress to the affected area to speed up the healing process. 3. Treat joint stiffness and arthritis pain with either heat or cold. Both methods can be effective in treating joint issues, though some people prefer one over the other. You might try alternating between the two until you figure out which one works better for you. 4. Avoid heat therapy if you suffer from certain conditions. Pregnancy, diabetes, poor circulation, and heart disease can respond poorly to heat therapy. Talk to your doctor before using a warm compress.